Hey everyone, and welcome to The Explainer. Today, we're diving into something that is super common, but honestly pretty misunderstood: the hernia. You've definitely heard people talk about it, but what's actually going on inside your body when someone gets a hernia? Well, let's get into it.
So here's our game plan. We're going to start with the absolute basics, what a hernia even is. Then we'll look at the body's anatomy to see where they tend to happen. After that, we'll cover the signs and symptoms, talk about treatment options, and wrap up with potential complications and, really importantly, how you can lower your risk.
All right, let's start at the beginning. What are we really talking about here?
Okay, so what is a hernia? The best way to think about it is like this. Picture your abdominal wall as a big, strong tire. Now, even a strong tire can get a weak spot, right? A hernia is basically the inner tube, which represents your intestines or some internal tissue, squeezing and bulging out through that weak spot. It's literally something from the inside pushing its way out through a hole in the wall that's supposed to be holding it in.
And get this, when it comes to hernias in the abdominal wall, a whopping 75% of them are what we call inguinal hernias. These happen down in the groin area. It is by far the most common place for that inner tube to find a weak spot to push through.
So what makes these weak spots finally give way? Well, it's usually a 1-2 punch. You've got an underlying weakness, and then you add a bunch of pressure inside your abdomen. The weakness itself might be something you were born with, or it could develop over time from aging or maybe an old surgical scar. Then you add things like a chronic cough, straining because of constipation, or lifting something heavy the wrong way. All that stuff increases the internal pressure over and over again, pushing against that weak spot until, pop, something gives.
You might be wondering, where do these weak spots even come from? It's not totally random. Our bodies actually have natural anatomical weak points, and understanding them is the key to understanding why hernias happen where they do.
Okay, so every hernia is made up of 3 basic parts. First, you've got the hernial orifice. That's the actual hole or defect in the muscle wall. Second, there's the hernial sac. Think of it as a little balloon made of the thin lining of your abdomen that gets pushed through that hole. And third, you have the hernial contents. That's whatever organ or tissue is filling up that balloon, usually a loop of intestine or some fat.
Now, for those really common groin hernias, there are 2 main flavors. An indirect hernia is kind of sneaky. It follows a natural tunnel that already exists in your anatomy. A direct hernia, on the other hand, is more like a straight-up blowout. It just pushes directly through a known weak area in the abdominal floor, creating its own brand new path.
Okay, so we know what a hernia is and where it happens, but the big question is, how do you even know if you have one? Let's talk about what to look for.
The classic sign, the one everyone thinks of, is a bulge that you can either see or feel, usually in your groin or your abdomen. It might just be a dull ache or maybe a weird dragging sensation. A real telltale sign is that the bulge gets bigger when you stand up, cough, or strain, and then poof, it gets smaller or even disappears completely when you lie down and relax. That's gravity and pressure at work.
So those are the typical everyday symptoms. But sometimes, hernias can become a serious problem. And it is absolutely crucial that you know the red flags that signal a real emergency. Okay, listen up. If you suddenly get severe pain right at the hernia site, if that bulge becomes hard and you physically can't push it back in anymore, or if you start vomiting and your belly starts to swell up, these are major alarm bells. This could mean the hernia is trapped, or even worse, that the blood supply to whatever's trapped in there is getting cut off. This isn't a wait-and-see situation, it's a surgical emergency. So let's say a hernia is diagnosed. What's next? Let's get into how these things are actually fixed. Broadly speaking, there are 2 paths. For a small hernia that isn't causing any trouble, a doctor might suggest what's called conservative management. That's basically just a watch-and-wait approach. But, and this is a big but, it doesn't actually fix the hole. The only way to truly cure a hernia is with surgery, which is designed to permanently repair that defect in the wall.
And you know, no matter which surgical technique is used, the mission is always the same, and it's pretty simple. Goal number 1, gently tuck the contents of the hernia back where they belong, inside the abdomen. Goal number 2, close and repair that hole so this doesn't happen again.
Now, there are a few ways to get that repair done. A classic herniorrhaphy just means stitching the hole closed. But what's much more common today is a hernioplasty. For this, the surgeon uses a piece of synthetic mesh to patch the weak area. Think of it like putting a really strong patch on the inside of your jeans. This has been a real game changer, and it seriously reduces the chance of the hernia coming back. And a lot of times, both of these can be done using minimally invasive or laparoscopic surgery.
And that brings us to our last section.
Why is it so important to get these things checked out? Let's talk about the risks of not treating them and, maybe more importantly, what you can do to try and prevent them from happening in the first place.
Okay, the complication everyone fears, and for good reason, is something called strangulation. This is what happens when the stuff in the hernia sac, usually a piece of your intestine, gets trapped so tightly that its blood supply gets completely choked off. This is incredibly dangerous because the tissue starts to die, and that's a life-threatening emergency that needs immediate surgery.
Besides that worst-case scenario, you can have other problems too. Incarceration is when the hernia is trapped but the blood supply is still okay. It can also cause an intestinal obstruction, where the trapped part of the bowel blocks everything up. And of course, even after a successful surgery, there's always a small risk that the hernia can come back down the road.
So, how can we be proactive about this? It all comes back to reducing that internal pressure we talked about at the start. Things like maintaining a healthy weight, using proper form when you lift heavy things, getting a chronic cough or constipation treated, and strengthening your core muscles, all of these things help support your abdominal wall and can really lower your risk.
So, that really leaves us with one final thought. We've seen that a hernia is all about a weak spot in a wall and too much pressure from the inside. So the question I want to leave you with is this. What's one thing you can do in your daily life, starting today, to give your body's natural wall a little more support against all that pressure? Thanks for joining us on The Explainer.